what is an ectopic pregnancy? Many women face an ectopic pregnancy nowadays. So let us discuss in detail about what is an ectopic pregnancy, what are the factors that can cause an ectopic pregnancy in women, and what are the signs and symptoms of an ectopic pregnancy. So stay tuned till the end of this video to know all the information. Hi, I am Saranya, the founder of Babypedia and a birth professional, and I have more than 5 years of experience helping a lot of pregnant couples through pregnancy, birth, and taking care of their newborn baby with a lot of confidence and ease. Now, what is this ectopic pregnancy? Generally, after the egg is released and the sperm is also available, fertilization will take place in the fallopian tube. After that, this fertilized egg will slowly move towards the uterus, and by 5 to 6 days after fertilization, it will get attached to the wall of the uterus. So when this fertilized egg attaches to the wall of the uterus, it is called implantation. Now, sometimes this implantation can happen outside the uterus. For example, inside the fallopian tube, in the cervix, that is the mouth of the uterus, in the vagina, or even it can, go outside the fallopian tube and get attached anywhere in the abdominal cavity. When this happens, this is called an ectopic pregnancy. The most common type of ectopic pregnancy is when it gets attached inside the fallopian tube. This is also called a tubal pregnancy. This is very risky because your baby cannot grow beyond a point inside the fallopian tube or in the abdominal cavity. And in case the fallopian tube bursts, it can prove very risky to your life as well. So that is why usually if you are experiencing an ectopic pregnancy, your doctors may advise or will advise you to look at terminating the pregnancy. So next, who is at risk for an ectopic pregnancy? Generally, any woman who is pregnant has a chance of having an ectopic pregnancy. This chance increases if you have had any abdominal surgery or any inflammation in your pelvis, if you are above 35 years, if you have become pregnant through fertility treatments like an IVF, and if you have, had an intrauterine device and then removed it and become pregnant, if you smoke, if you have a history of ectopic pregnancy, or if you have an history of sexually transmitted diseases like gonorrhea, chlamydia, then this can increase your chances of having an ectopic pregnancy. So how do you know if you have an ectopic pregnancy? You may experience one or more of the below symptoms, like light to heavy vaginal bleeding in the first few weeks of pregnancy, pelvic pain, upset stomach and vomiting, sharp pains in the abdomen, shoulder and neck pain, an urge to have a bowel movement, extreme lightheadedness and fainting. All this will happen in the first few weeks of pregnancy. Now, your experience may be totally different. You may have one or more of these symptoms, but if you have any of these and you're suspecting an ectopic pregnancy, please rush to your doctor. So how does your doctor diagnose that you have an ectopic pregnancy? Your doctor will take a urine test or a blood test. So now generally the HCG hormone will slowly keep increasing as your pregnancy progresses. But in case it stops increasing or it starts reducing, this could indicate an ectopic pregnancy. The second way that your doctor will find out is through a transvaginal scan. The doctor will insert a wand into your vagina to see where your baby has been implanted. Based on these two, your doctor may give you recommendations. So the general mode of treatment would be either if you are very early into your pregnancy, they may give you tablets or medicines that will help, kickstart bleeding and terminate the pregnancy. In some cases, you may need surgery, and in extreme cases to remove the fetus, and in extreme cases they may have to remove and tie your fallopian tube itself. Don't worry, a lot of women who've had ectopic pregnancies go ahead to have healthy pregnancies after this. But also understand that an ectopic pregnancy is a pregnancy. So it can leave you feeling very vulnerable, feeling like you've lost your baby, feeling very upset and not able to show it out because not many people will understand what you are going through. It is okay to take some time to heal yourself, to come out of it, to, if you want, you can talk to a professional, but your feelings are valid. Take care, Get back, bounce back physically and emotionally, and then plan for your next pregnancy. Don't just jump right in. Your body and your mind needs to heal after this experience. Take care, and if you found this video useful, do like and subscribe to Babypedia to get more information about pregnancy, birth, taking care of your newborn baby with a lot of confidence and ease. This is Saranya signing off.